Good afternoon, and thank you so much for joining us today. All the microphones are muted and the cameras are disabled, so I can't see you, but you can see me. I'm going to do my very best to stay in our 30-minute timeline today. Thank you to all who provided questions in advance. I've done my best to work them into the presentation. But of course, if there are additional questions and we have time at the end, I'll invite you to put those into the chat box. So be jotting those down as we go today. Today's State of the Union is just one of the many exciting activities that we have planned throughout this week, our 10th anniversary virtual gala celebration. And I would like to just thank our co-chairs for the ongoing event, which was supposed to be in May and then October and now virtual, Lana McCrum-Craig and Allie Alter. And I also want to thank our sponsors, our very generous sponsors, St. David's Healthcare, Altura HealthShare, Huggies, and Austin Subaru. Thank you so much for making all of this possible. So let's start from the beginning. For the past decade, our mission has been and continues to be to provide support to families before, during, and after their NICU stay, providing powerful resources for the whole family, and most importantly, one-on-one mentoring from someone who has been there. Hand-to-Hold is unique in that we are the only nonprofit organization that serves families before the NICU. In the event that the mom is on bed rest or has received a diagnosis for her child, we're there for her from the very beginning. We walk with her and her entire family throughout their NICU stay, whether it be a few days, a few weeks, or many, many months. And we continue our support well after a NICU stay. Again, we're the only nonprofit organization providing ongoing support for NICU graduate families in a time when often report that they feel isolated and alone and are desperate for connection and support and resources for their family. So why do NICU families need our support? Well, 1 out of every 7 babies spends time in the NICU. So that's more than 500,000 babies a year, equivalent to, for our University of Texas football fans, that is 5 University of Texas football stadiums at full capacity per year spending time in the NICU. NICU parents are up to 70% more likely to develop depression, anxiety, and PTSD, which can impede them from bonding with and caring for their baby. NICU parents are also at a higher risk for separation and divorce. They also have income and financial instability due to the ongoing medical bills that continue to come well after a NICU stay. And as much as we don't want to talk about it or acknowledge it, they are also at a much higher risk for abusing their child. NICU graduates face their own challenges. They're at a higher risk for ongoing medical challenges, developmental delays, and learning disorders that can impede their kindergarten readiness and their overall education experience. It is so important that we understand the correlation between a mom's mental health and her child's later social, emotional, and cognitive development. NICU babies need healthy parents to achieve healthy futures. It's important for us to stop and acknowledge as well that women of color are 49% more likely to experience preterm birth and also have a higher risk for experiencing perinatal mood disorders. They are less likely to have access to support and have been disproportionately impacted by COVID-19. Hand-to-Hold is committed to standing in the gap that currently exists in our healthcare system to provide the emotional support that NICU and bereaved families need. We have been referred to as the trauma care team for parents who experience traumatic birth. Over the past decade, we have created a proven model to improve outcomes for even the most vulnerable families. We have developed a curriculum, trained professionals, and partnered with hospitals to support NICU and bereaved families in a way that simply didn't exist before. So what exactly do we do? At the foundation of what we do has been and forever will be peer-to-peer support. We understand the value of that natural bond and trust of being supported by someone who has been there. We have built a national peer support network made up of hundreds of mentors across the country. We match these peer mentors with new families who have experienced a similar birth experience or or have experienced a same diagnosis. We host diverse online communities where families share heartache and joy, offer and receive support, and access information about meeting the ongoing needs of their medically fragile child. We host educational webinars and 5 podcast channels for NICU parents and professionals. We offer free counseling services for NICU and bereaved families in Texas. Currently, we partner with 5 hospitals in Texas where our trained peer support certified family support specialists provide direct support at the baby's bedside. They also host support groups at their hospitals and manage our very popular Milestone Bead program, a program that's designed to help parents find joy in their NICU stay by celebrating major milestones like that first diaper change, the first hold, and the first bottle. Over the last decade, Hand to Hold has connected tens of thousands of NICU parents annually to life-changing support to help them heal from trauma and bond with and care for their medical fragile baby. We've witnessed families return after healing from their own journey, now ready to give back and help others. So how far is our reach? handtohold.org is now one of the leading websites for NICU parents. We have welcomed more than 330,000 unique visitors this year. We have more than 63,000 followers on Facebook, Twitter, Instagram, and Pinterest. Our monthly blog that features articles on everything from postpartum depression to caring for your baby during cold and flu season. And that reaches 33,000 subscribers each month. And our amazing podcast channels have more than 68,000 downloads. Our digital presence continues to grow as the additional stressors of COVID-19 have compounded the challenges of a NICU stay. Visitation restrictions and limited access to mental health services in the NICU and in their communities has parents nationwide reaching out and seeking support from Hand to Hold. We've also seen a significant increase in requests for support from NICU graduate parents who are reporting that COVID has brought back similar fears and anxiety that they experienced during their NICU stay. With support from Huggies, we pivoted quickly, and in April, we launched virtual support groups for NICU families and NICU graduate families nationwide. We currently offer 8 groups weekly in English and Spanish, and at the request of Black moms, have designated 1 session per week just for LIM. That is led by a Black family support specialist that best understands their unique needs and challenges. We have had a 64% increase in attendance since April and have welcomed parents from 21 states. We have had a 241% increase in requests for peer mentors and currently have matches in 48 states and 6 countries. We have doubled the number of families served in our counseling services from 219 to 220. And our podcast about the impact of COVID on the mental health of NICU professionals was listened to by more than 12% of all NICU nurses across the country. I want to pause and just thank Huggies for their ongoing support to make this happen. They are helping us reach families across the country like never before. Just a few facts about Hand to Hold's exponential growth over the past decade. I started Hand to Hold while I was struggling to manage 2 little kids. I actually wrote their first business plan, if you will, in my daily devotional, sitting in the carpool pickup line, waiting to pick up my kids from preschool. It's exciting to report that I hired my first employee in 2013, and now we have 20 employees in 4 cities in Texas and growing. And despite the tremendous challenges associated with COVID-19, including the cancellation of our 10th anniversary gala that we would be attending on Friday, we are on track to hit our $1.3 million income projection for the year. Only 30% of nonprofits nationally reach $1 million budget. So we have a lot to be thankful for and a lot to be proud of. To recap, in the past 10 years, your investment and that of generous corporate sponsors and foundations has helped Hand to Hold reach hundreds of thousands of families a year, become a national thought leader in NICU family support, serve families on a global scale through our peer mentor network and podcast, and build a business model based on both philanthropy and earned income to provide that long-term sustainability that we so desperately need. So what do we have in store for 2021 and beyond? Our vision remains clear: to ensure every NICU family is not alone and has individualized support for their child to thrive. We will continue to increase awareness of Hand to Hold's free and virtual services through our strategic partnership with Huggies and other corporate sponsors. We will also continue to increase our earned income through partnerships with hospitals to provide our ambassador program to other hospitals, expanding across the state of Texas. And we continue to focus on our online store sales, giving us that earned need, and focusing on the sale of our milestone bead necklaces to hospitals across the country. In light of COVID-19, we have a renewed focus on virtual peer-to-peer fundraising, and we're going to be launching a new virtual platform to do that, associated with the Austin Marathon next year. We will continue to leverage the current focus on maternal health and increase focus on women of color specifically to secure grant funding to support the most vulnerable in our communities. And now I am very excited to announce that we will be launching a new custom-built online community for NICU parents and professionals, which will be built on the Austin-based On the Dot platform. Hand to Hold's NICU community will transform connection, support, and education for NICU parents and professionals, fostering community to improve outcomes for NICU babies and their families. The first online community for NICU families, and really one of the first online communities for any nonprofit across the country. And with this new amazing platform in place, I'm also excited to announce that Hand to Hold will be hosting the first virtual conference for NICU parents and professionals in September of 2021. The conference will feature topics related to the ongoing care and development of NICU graduates, as well as topics related to the ongoing mental health challenges NICU graduate parents face. I invite you to join Hand to Hold in our extraordinary mission to fill the gap in our healthcare system, a system that largely has ignored the impact of a traumatic birth on the mental health of NICU parents and the ultimate long-term impact on the baby and the entire family. Systematic, entrenched problems require long-term heroes and heroines and 100% commitment. Hand to Hold has a bold vision for a bright future for NICU babies and their families, but we need your help. Just this week, we invite you to join us in our anniversary. Visit handtohold.org and participate in our silent auction, in our raffle, or make a contribution to our campaign today. It is only because of you that we are able to maintain all of our resources and services for our NICU and bereaved families for free. The impact of Hand to Hold in the lives of NICU and bereaved families would not be possible without the support of our generous donors, the leadership of my amazing board, the hard work of our dedicated staff, and the support of hundreds of volunteers. Thank you all for the role that you have played over the past decade and for the support that I know you will continue to give in the future. I also want to just take a moment to thank my husband, Michael Kelley, and my children, Jackson and Lauren Kelley, and my co-founders, Dave and Allie Alter, for your unwavering support. If you would like to schedule an appointment with me to have coffee with Kelly, I would invite you to send me an email at Kelly, Kelli, @handtohold.org, or call me directly, 512-293-0165. That's 512-293-0165. If you would like to talk to me about how you would like to get involved with Hand to Hold to help support and advance our mission, if you know of a grant that we need to apply for, if you know of a corporate sponsor that you want to introduce me to, we ask for all of you. It takes a village. So help us advance the mission of Hand to Hold. And with that, it looks like we do have some extra time. So I'm going to invite you now, if you have any questions that you would like to ask about Hand to Hold and where we're going in 2021 and beyond, please put that into the chat session. And in the meantime, I am going to go over here and look at some questions that we've already received in our previous State of the Union address. And so this one was my favorite, so I thought I would pull this one out first and give you time to put in any questions that you have. In a perfect world, let me grab some water here. All right, so in a perfect world, how would care for NICU families while in the hospital change over the next 10 years? I say that's easy because Hand to Hold strongly believes that we need to be in every NICU. Do I believe that's possible in a decade? I do. I believe we have to have a bold vision and a big plan and go for it because NICU parents deserve it and they need it, and we're dedicated to doing that. So I think that's our first drive. I'm so sorry, I got a dry throat here. All right, I'm looking at your questions. I like the questions about the raffle tickets. Yes, raffle tickets are available. Amazing, amazing raffle prizes, silent auction items, lots of ways for you to give and get during this season. And you can be thinking ahead about Christmas and holiday shopping and do some of that in our amazing raffle. So here's some other questions that we've received. Has language or socioeconomic status created any additional barriers on access to virtual services during the pandemic? Or do you feel that there are enough access points to touch all families? I think the honest answer to that is no. I don't think everyone has equal access. We even hear from families that don't have digital plans for their phone, are able to expand the time that they have available on their phones. So not all families have laptops and are able to connect. So, you know, that's one of the beautiful things. While families are in the NICUs that we serve, we're able to be there and provide support directly to them. And once they go home, our ambassadors can certainly reach out by phone. Would we like them to be able to provide, join the virtual support groups? Absolutely. So I think this is something that we will stay focused on. I know that there's a lot happening in the state specifically to address these problems in access to technology. So we will be looking at grants to make sure that we can provide that kind of access to all the families that want to stay connected to Hand to Hold and to our free resources. All right, I'll go to one more question. If there's any other questions you'd like to put in the chat section. Okay, do you think that hospitals around the country have done a good job pivoting and how they provide family-centered care with current restrictions? That's a hard question, I have to say. I think that it has been very, very hard on NICU parents to not be able to be in the hospitals. We've seen very different standards across the country in dealing with they put in place. So I think I'm always going to advocate for parents to be at the bedside of their baby as much as possible, because we know that improves outcomes of the baby, but also of the parent. I think it's really important for the parents to be there to bond with and provide those cares as they can, because they're learning to be the main care provider for that medically fragile child. I think it's very difficult when only one parent can visit at a time and they're not able to be there to support each other. I've even had a NICU director just telling me how difficult it is for her staff, who would normally be able to give a hug when a baby is lost, or when at the bedside when things are not going well. And there is no touch there in the NICU. But I am certainly not going to be the one to stand here today and say that I know what's best in how to best protect the health our medical professionals and the babies and the parents. So I think with that, I would just say, I think it's as important that as soon as it is possible to lift the restrictions and allow parents to be there more and be there together, I know that hospitals are going to respond and do that, because I know they want that for the babies. All the NICU professionals want that. So I think that hopefully what we're going to see as soon as there's vaccinations and other things to make sure that we can maintain the health of our medical professionals and those babies and families, will lift those restrictions. All right, well, I am not seeing any other questions in the chat, so I'm just going to thank you so much for joining us today. Thank you for your support over the past decade, and please visit handtohold.org and take a look at our online virtual celebration this week. Thank you again to the co-chairs Lana McCrum-Craig and Ali Alter, to our amazing corporate sponsors, St. David's Healthcare, who's been with us there from the very beginning and took care of both of my NICU graduates who are off at college and doing great. Thank you to Altura HealthShare, a new corporate sponsor last year and who have come on strong, and we so appreciate their support. We thank you to Huggies, who have just transformed our access and our reach this year to NICU families, and to Austin Subaru, who I know love and appreciate our mission and have been personally touched by our mission, and we just so are grateful for you. And all of our other donors and corporate sponsors, all of you who just remain committed to your support, even though we had to cancel our in-person gala. So thank you all so much. Have a wonderful week. Thank you for joining me today and your support of NICU parents. We appreciate you.